I'm Christy Steyer. Thanks for joining us tonight. Breaking news right now. A public health emergency has been declared by both the governor and the president of the United States after learning the pandemic influenza virus could be more severe than originally thought. New CDC data shows a 3% case fatality rate, meaning 3 out of every 100 sick people are dying. The figures are prompting the U.S. to elevate the pandemic severity index to a category 5. In an effort to help slow the spread of the virus, federal and state officials are increasing the time for implementing community defense strategies to 12 weeks. Some of the strategies could include closing schools, banning public gatherings, and modifying the workplace. The virus has now spread to every county and every community within the state, which prevents the public health department from counting the exact number of flu cases. That number, though, is expected to grow every 4 days until the virus peaks. 832,000 new cases are predicted in Alabama by the end of the month. Naturally, the increase in cases means an increase in deaths. So far, Alabama is reporting more than 1,000 deaths related to the pandemic virus. Hundreds more are being investigated. If the number of cases increases as projected, more than 20,000 Alabamians could die during this pandemic. This means several counties should expect challenges with morgue storage, transportation, and community education. Challenges are popping up in healthcare facilities already. Waiting rooms at hospitals and doctors' offices are filled to capacity with patients experiencing flu-like symptoms. Provider staff members are calling in sick or simply not showing up for work in fear of becoming infected with the virus. The overwhelming medical need has pushed hospitals to maximum operating capacity, and they've been forced to implement reduced standards of care protocols. Long-term facilities like nursing homes and prisons are also experiencing a large increase in medical surge, staff absenteeism, and deaths. State and local public health facilities are providing education and what's left of basic supplies like N95 masks, hand gel, and gloves. The only preventive medicine is the vaccine, which unfortunately won't be available for several more weeks due to manufacturing guidelines. We go now to State Health Officer Dr. Don Williamson, who's giving the very latest on the pandemic.
Good afternoon. This is State Health Officer Dr. Don Williamson. On behalf of the Alabama Department of Public Health, I'd like to update you on the pandemic influenza situation. The governor's declared public health emergency is in effect. Alabama is in the 7th week of the second wave of this pandemic. The first wave lasted 12 weeks. We expect this wave to last up to 16 to 20 weeks. We may be near the peak of the second wave and the transmission rate should slow down. This does not, however, mean that we are in the clear, nor does it mean the pandemic is over. Because physicians and hospitals have been overwhelmed for 4 months, we must remember that the vast majority of people who get influenza do not need to see a physician. Stay home, stay hydrated, and keep your fever down. It may take several days or even weeks to recover, but the vast majority of individuals who get influenza will make a full recovery. When you get the flu, please call your physician, let them know you're ill. The only treatment available once you have influenza is antivirals, and they can be prescribed over the phone. If you experience complications like shortness of breath, blueness around the mouth, chest pain, feeling better, then getting worse, please go to your local healthcare provider. So far, the death toll is about 1,000. In the end, Alabama could well experience over 20,000 deaths resulting from pandemic influenza. We need the public to understand local mortuary services are overwhelmed and will continue to be that way for several more weeks and months. Please listen to your local EMA representatives for instructions and let them know if you can assist by implementing your local fatality management plan. While we had hoped new technology would be available to make vaccine quickly, it is not. The same chicken and egg process is being used, and we do not expect any new vaccine to reach the state until the end of the second influenza wave. Please remember, everyone should stay home unless it is absolutely necessary to go out. For those who must leave home, remember to stay 6 feet or more from others who are coughing and sneezing. If you have a sick family member at home, isolate that person as much as possible and keep them comfortable. Remember, wash your hands, carry hand sanitizer everywhere you go, and use it often. We at the Department of Public Health are working hard to assist hospitals and other healthcare providers throughout the state. Hospitals are currently filled to capacity and caregivers are overwhelmed. Please do not go to your healthcare provider or hospital unless you have a true medical emergency. Please visit our website at adph.org for more information as it develops. Thank you.
Again, that was State Health Officer Dr. Don Williamson with an update on the pandemic. And he goes on to say that it's not just Alabama getting hit hard by the virus. Outbreaks and resource shortages are also being reported in neighboring states of Mississippi, Georgia, Tennessee, and Florida. That will prevent all of us from assisting each other as we normally would in other emergency situations. Now, in an attempt to stop the spread of the virus, state officials are closing all schools and colleges, banning all sporting and religious events, and prohibiting gathering in crowds of any kind until further notice. Representatives from Alabama Power, Alagasco, TVA, and most major critical infrastructure companies say they're doing their best to keep essential functions operating, but things may be slower than normal due to high absenteeism from their employees. Now, it is the same situation for many retailers in the area. Many are closed because employees are out sick. Some places like Walmart and even Target are still open, but their stock may be in short supply. Now, remember, the death toll from the pandemic virus is staggering in Alabama. Here, we're averaging up to 225 deaths every day, and many around the state are scrambling to deal with the loss of life. We turn now to the Alabama Emergency Management Agency Director for an update on critical infrastructure and other state services affected by this pandemic.